the cellular adaptations. So first of all, as I already explained in the previous class, basically cellular adaptation is nothing. It is a change in a cell, which usually occur when you are putting a stress on any kind of cell. Let's suppose I am giving one example here. This is the cell, and let's suppose you are putting a stress on this cell. And now, if this cell has to handle this stress, it will go under certain changes. Might be it can increase its size, which we call hypertrophy. Might be it can increase in number of cell, which is called hyperplasia. So basically, these are the growth changes which we called at the cellular level cellular adaptations. So this is the basic definition. Then cellular adaptation, these are the reversible changes. What is the meaning of reversible change? Let's suppose if I put a stress on one cell and that cell is going to increase in size, and after I remove the stress, that cell will come back to its normal size. So that's why these cellular adaptations are called reversible changes. Reversible changes mean when you are removing the stress from the cell, it will come to its original shape, size. So this is about the reversible change. Then you have to keep in mind these reversible changes can be physiological, like I already explained in the last day class. During the pregnancy, the uterus enlargement occur, and it can also be pathological. Pathological mean it is because of myocardial hypertrophy secondary to systemic hypertension. So let's try to understand with the help of an example. Let's suppose it's your left ventricle. It is the left ventricle, and we know that in the front of left ventricle there is aorta. In case of systemic hypertension, we know that the vascular resistance in the aortic vessel is increased. So if the systemic vascular resistance is increased, it is a kind of stress on the left ventricle. So it's mean when the resistance is more in the aorta, left ventricle has to work more. No, left ventricle, if we want to increase, if we want to take more work from the left ventricle will go under certain changes. It will go under hypertrophy. So basically, whenever you are putting a stress, like I explain here, one example of systemic hypertension. In case of systemic hypertension, there is systemic vascular resistance increase, and when the resistance is increased, it will put a more pressure on the left ventricle. And when the pressure is more on the left ventricle, it will undergo hypertrophy. It's mean it will increase its size. So left ventricular size will increase. It is called left ventricular hypertrophy. But as I already explained, it is a case of systemic hypertension. And systemic hypertension is not a normal thing. It is a pathological. So that's why they mention here the cellular adaptations. They can occur at the physiological level, like during pregnancy. We know that uterus size is increased. Why uterus size is increased during pregnancy? You have to keep in mind during the pregnancy, uterus size is increased because of hyperplasia and hypertrophy. This is the, you can say, an example where the hypertrophy and hyperplasia occur together, and that is an example of physiological. And in pathological, we have systemic hypertension that will lead to myocardial hypertrophy. So this is about the, we can say, simple reversible changes. Now here it is mentioned that if that stress is excessive or persistent, adaptations can progress to cell injury. So what is the meaning of this line? Let's suppose we will take again an example. So let's suppose this is the heart, and this is the left ventricle. In the left ventricle, we know that in front of it there is aorta. So let's suppose if the person is having hypertension from the 5 year, and that person is not taking any kind of systemic, we can say, antihypertensive drug. So if you are not going to take the antihypertensive drug, you are continuously, you are persistently, you are excessively putting a stress on the left ventricle, and this left ventricle will increase its size, which we call left ventricular hypertrophy. But if this hypertension is not controlled, if this hypertension is continuously exerting a pressure, exerting a stress on the left ventricle, that left ventricle hypertrophy will convert into the left ventricular failure. So it's mean if we do not remove the stress from a cell, it will lead to the cellular injury. So that's why it is mentioned that if the stress is excessive, if you are putting more stress, or if the stress is persistent from many years, these cellular adaptations can progress to cellular injury. So please keep in mind, hypertrophy and hyperplasia, these are not at the level of cellular injury. These are the growth adaptation. Cell is trying to adopt the changes. Cell is trying to adopt the stress which you are putting on that. And cell is adopting the stress with the help of hypertrophy and hyperplasia. So that's why they also mention here, if the left ventricular hypertrophy is significant, it will lead to myocardial injury and eventually it will lead to heart failure. So that's about the first paragraph. Let's take a quick review. First of all, you have to keep in mind cellular adaptations. What are cellular adaptation? These are the, you can say, growth changes. These are the changes which occur when you exert or when you put a stress on a cell, and these changes are reversible. You have to keep in mind, if you remove a stress, that change will finish, and if you are not like removing that stress, it can lead to cellular injury. So that is an easy example you guys have to understand. After that, let's take an example of first growth adaptation or cellular adaptation, that is hypertrophy. So first of all, we have to understand the basic definition. What is hypertrophy? So let's take an example of one cell. This is an one cell, and you can say it is a cell of the left ventricle. I am taking this cell from the left ventricle. In case of hypertension, what happens? Hypertension is a kind of stress. So when the stress is exerted on the left ventricle, the left ventricular cavity size or the left ventricular cell size is increased. So you have to keep in mind, hypertrophy, its simple mean an increase in stress that can lead to increase in organ size. It is called hypertrophy. Hypertrophy simply means it will lead to increase in size. So here they mention, in the hypertrophy, when the cell size is going to increase, so how that cell size is increased, you have to keep in mind, there are the three things which help to increase the cell size. First one is, whenever you are putting a more stress on the cell, if that cell has to increase its size, it has to increase its protein synthesis. If the protein synthesis is increased, then the organ size or cell size will increase. Second thing, if you want to increase the more protein synthesis, you have to activate certain genes. It's mean gene activation is also increased. So without gene activation, you cannot make the protein synthesis. So that's why if you want to increase the protein synthesis, you have to activate the gene. And third thing, you have to increase the number of organelles. You have to increase the number of organelles. And organelle means you have to increase the number of mitochondria. So here it is mentioned on the book, in the hypertrophy, increase in structural proteins and organelles, but they didn't mention here about the gene activation. You guys can keep in mind, structural proteins are only increased when you are activating the gene. And genes, you know that in our body, in our chromosomes, there are different kind of genes which are regulated when we have to increase the protein synthesis. And both these changes, like increase in protein and increase in organelle, will lead to increase in the size of cell. And here the example they mention is cardiac hypertrophy. It's mean, from you in exam, they will give you example of let's suppose a 55-year-old man come to your office and he's complaining, doctor, I'm having the chest pain, and you are doing the echocardiography. On the echocardiography, you see there is increased size of the left ventricle, and they will ask, please tell us what is this change, why the cell why the left ventricular size is increased. It is because of hypertrophy, it is because of hypertension. So this, that's all about the hypertrophy. Then next we'll discuss about the hyperplasia. So first of all, again, we have to understand the basic difference between the hypertrophy and hyperplasia. So let's take an example of another cell. This is a normal cell, and let's suppose if I am going to put a stress on this cell, and if this cell increases its size, if the cell increase its size, it is called hypertrophy. But if this cell will not increase its size, it only increases the number of cells. Let's suppose from one cell, you make the 3 cell. So it's mean you are going to increase the number of cells, and the number of cells are only increased when you have the stem cell, because if you want to produce the more cell, you have to going to stimulate, and if you are going to proliferate the stem cell, then it's only possible you can increase the number of cell, and this is called hyperplasia. So hyperplasia mean increase in number of cells, and hypertrophy mean increase in size of cell. So this is a you can say basic difference between these two things. So let's now read from the first A. They mention controlled proliferation of stem cell and differentiated cell. It will lead to increase in number of cells. So what is the meaning of controlled proliferation of stem cell? It's mean when you are going to increase the number of cell, the stem cell which are going to be stimulated, they are under control. You will not stimulate, they will not proliferate unexcessively. So this is the meaning of controlled proliferation. And they mention here one example: benign prostatic hyperplasia. Like it is a condition in which prostate gland size is increased, and prostate gland size is increased because of increase in number of cells. And here they also mention, if the stress is excessive, if you are not removing the stress, and if that stress is going to excessively stimulate any organ, that can lead to pathological hyperplasia. And here they mention the example of endometrial hyperplasia, and that endometrial hyperplasia, if you didn't still remove the stress, can progress to dysplasia, which is precancerous condition, and that precancerous condition can convert into cancer. So let's take an example. This is the uterus. Let's suppose this is the uterus, and we know that on the uterus, uh, estrogen work as a stimulating agent. So let's suppose if a female is excessive obese, if a female is excessive obese, when a person is obese, in the body, more estrogen will produce, and if the more estrogen will produce, it will go to the uterus and stimulate the uterus. That will lead to increase in, that is called endometrial hyperplasia. But let's suppose if this female is not going to lose its weight, and the weight is still increasing, that can lead to pathological, like pathological production of estrogen, and that pathological production of estrogen will go and lead to pathological hyperplasia. And if you will not lose the weight, if you will not decrease the production of estrogen, that can lead to dysplasia. Because I already mentioned in the last class, hyperplasia can progress into dysplasia, and dysplasia can progress into cancer if you do not remove the stress. So that that's all about the hyperplasia. But they can ask from you in exam, there are certain conditions in which, let's suppose if the person has hyperplasia, it will not go into the cancer. So you have to keep in mind, in our body there is one exception, especially if you have the prostatic hyperplasia. Benign prostatic hyperplasia is not going into prostate cancer. This is the one example, or you can say one exception. And also we have one exception in the hypertrophy. Let's suppose if the female has like the apocrine of breast, as I already mentioned in the previous class, if the female has the apocrine condition of the breast, that will also not going to into the breast cancer. So these are the two exceptions which you guys have to keep in mind. So that's all about the hypertrophy and hyperplasia. So let's now discuss about the atrophy. So again, what is the definition of atrophy? When there is decrease in a tissue mass. When the tissue mass is decreased, it is called atrophy. Let's suppose this is example of any tissue. If you are going to any kind of stress, or if you are going to uh, put any kind of stress, as I already told, there are certain kind of changes in the cell. So let's take example of this tissue. If you are going to stress, that will lead to decrease in size, and organ size will decrease. It is called atrophy. Atrophy simply mean when you are going to decrease in stress, that will lead to decrease in organ size, and when the organ size is decreased, it is called atrophy. As I already mentioned in the previous class, there are two methods, there are two mechanisms through which the tissue mass is decreased. first one, you have to decrease the size of cell. Second, you have to decrease the number of cell. They can ask you uh, in exam how the tissue mass is going to decrease. There are two mechanisms. First one mechanism is you have to decrease the size of cell, and size of cell is decreased with the help of ubiquitin proteasome degradation pathway. And the second thing, you have to decrease the number of cell. How the number of cell is decreased? They are going to be decreased by apoptosis. So please keep in mind these are the two mechanisms which will together lead to decrease in tissue mass. So here they mention decrease in tissue mass occur due to decrease in size. And how the size is decreased? Because you have to increase the cytoskeleton degradation. How we can increase the cytoskeleton degradation? With the help of ubiquitin proteasome pathway. This is the first mechanism. And second, we have the autophagy. Autophagy will lead to decrease the number of cellular components. It will decrease the protein synthesis. It will decrease the cellular components. And the second thing, how we will decrease the number of cell? We can decrease the number of cell with the help of apoptosis. Apoptosis means it is a programmed cell death. If you let's suppose if you are going to, you have to cells are going to be reduced. And if the number of cell are going to be reduced, and if the size of a cell is going to reduce, overall it will lead to decrease in tissue mass, that is called atrophy. So here they mention there are certain examples which can lead to atrophy. First one is disuse. What is the meaning of disuse? Let's suppose I'm going to give you one example. If a person is going to gym, and in the gym he's like doing the exercise of biceps muscle daily, he is going to train his bicep muscle, and you will see like his bicep muscle will increase, and its size will also increase. But let's suppose if this person is not going to gym now, and he say I will not go to gym anymore for 5 7 8 years, and you will see after he stopped the gym, his muscle mass will decrease. This is an example of disuse. Like if you will not use your muscle, they automatically come to their normal like condition. Their size will automatically decrease. So this is an example of disuse. Another is de-innervation. What is the meaning of de-innervation? Let's suppose this is a muscle. Again, I will take the example of muscle, and we know that in our muscle, in our body, these muscles are under control of certain nerves. If this nerve is going to stimulate this muscle, it will contract. If this nerve is going to innervate this muscle, it will relax. So let's suppose if you are going to cut this innervation, if you are going to cut this nerve supply, this muscle will not get any innervation. So with the to decrease its size. So this is an example of de-innervation. And second thing, loss of blood supply. So you can take an example. Let's suppose if the blood is going to if the blood is going to any organ, and this blood has all the essential nutrients for to growth, for increase in size. But if you stop the blood supply, if, if you stop the blood supply, the blood will not go to any organ. And if the blood will not go to any organ, that organ will not get its nutrient supply. So automatically their size will also decrease. So this is another example through which you can decrease the size with the help of loss of blood supply. Then second, loss of hormonal stimulation. And this is another example. If you are going to, let's suppose, withdraw the hormonal stimulation from any organ, if you are not going to stimulate the organ with the help of hormone, that organ will not get any stimulation signal. And if the organ will not get any stimulation signal, their size will automatically decrease. And this is an example of atrophy. And other example is poor nutrition. If you are not like eating well, if your diet is not like full of nutrients, then automatically your body will not get all the proper nutrients. Your cell, your body is not going to increase. They automatically it will decrease in size. So here they mention the some causes which can lead to atrophy like disuse, denervation, loss of blood supply, loss of hormonal stimulation, and poor nutrition. You guys have to keep in mind. So the most important thing they can ask from you in exam. First of all, what is atrophy? It is simply decrease in organ size. So second thing they can ask, to how many mechanisms you can decrease the organ size. First one, by decreasing the size of cell. Second, by decreasing the number of cell. Then they can ask from you, like how you can decrease the size of cell, how you can decrease the number of cell. You can decrease the number of cell with the help of apoptosis. What is apoptosis? It is a program that is a cell death program. And how you decrease the size of cell? You can decrease the size of cell with the help of ubiquitin proteasome pathway. And I already explained, ubiquitin is basically a protein, and proteasome, these are the organelles which have the hydrolytic enzymes, and these hydrolytic enzymes will degrade the cytoskeleton proteins. Those cytoskeleton proteins which have ubiquitin, or you can say ubiquitin tagged cytoskeleton proteins, will go to the proteasome, and in the proteasome we have the hydrolytic enzyme. Those hydrolytic enzymes will degrade the cytoskeleton, and if you are degrading the cytoskeleton of a cell, you will decrease the size of cell. So this is an other mechanism. And second thing, autophagy. Autophagy is a process in which a cell will undergo a vacuole formation, and with the help of vacuole formation, these vacuoles will go to the lysosome, and those lysosome again will destroy the cell, which will lead to the decrease in size. So that's all about the atrophy. Now let's discuss about the metaplasia. First of all, what is metaplasia? Basically, it is a reprogramming of stem cell. What is the meaning of reprogramming? Basically, you are going to replace one cell type with another. And why this is going to happen? It is mainly because of stress. Let's suppose I am going to give one example. Let's suppose this is the esophagus, and here is the stomach. And we know that in the stomach there are parietal cell. Like parietal cell are going to secrete the hydrochloric acid, and hydrochloric acid is normally not going back into the esophagus. Normally, the stomach, the acid in the stomach is not going back into the esophagus. Why? Because of lower esophageal sphincter. But sometime, some of the person has condition GERD, gastroesophageal reflux disease. What happen in this condition? The acid is going back from stomach into the esophagus. Normally, the esophagus is lined with which kind of epithelium? This is an important MCQs. Normally, the esophagus is lined with non-keratinized epithelium. This is the normal epithelium. But when the acid is going back into the esophagus, that epithelium is not going to handle the stress. That epithelium will say, I cannot, I cannot handle this stress. And that epithelium is changed with another epithelium. Like non-keratinized squamous epithelium is going to be changed with non-ciliated non-ciliated columnar epithelium. So basically, it is an example of metaplasia. What is metaplasia? You are changing the one cell type with another. Like here, I give the example of esophagus. Like normally, esophagus has non-keratinized squamous epithelium. But if you have the GERD, if the pathologically acid is more coming from stomach to the esophagus, it is going to put more stress. And if you are putting the more stress, that cell type or that epithelium will change into another, and it will go into the non-ciliated columnar epithelium, which is mucin producing. So this is an example of metaplasia. So here they also mention usually it is due to exposure to an irritant such as gastric acid, esophageal epithelium replaced by intestinal epithelium, which is called Barrett esophagus. What is the meaning of esophageal epithelium replaced by intestinal epithelium? It's mean normally the esophagus epithelium is non-keratinized stratified squamous, but it is going to be replaced by it is going to be replaced with non-ciliated columnar epithelium. And this change of epithelium is called metaplasia. And this type of metaplasia which occur in the esophagus, it is called Barrett esophagus. You have to keep in mind. Same like that can happen in the respiratory tree. The tobacco smokers, in the smoking, if a person is smoking in the tobacco, there are certain kind of toxins or chemicals. Those toxins and chemicals are going into the respiratory epithelium. Normally the respiratory epithelium is ciliated columnar type of epithelium. But if you are smoking and from the tobacco exposure, this ciliated columnar epithelium is going to be replaced with stratified squamous epithelium. Why this is going to happen? Because the stratified squamous epithelium can handle the stress very well. Ciliated columnar epithelium cannot handle the stress. So that's why it is going to be replaced by the better cell, which can handle the stress. And that kind of change is called metaplasia. But always keep in mind, metaplasia is reversible. It's mean if you treat the GERD, automatically acid will not go from stomach to the esophagus and the epithelium will not change. Same like that, if the person can stop the tobacco smoking, their respiratory epithelium will also not change. So it's mean metaplasia is also reversible. But keep in mind, it can progress to dysplasia. And dysplasia, basically, it is a malignant transformation with persistent insult. It's mean if you are putting the continuous stress on the organ, that organ will to the cancer. Let's suppose Barrett esophagus, if you not treat the GERD, it can lead to the esophagus cancer, which is esophageal adenocarcinoma, and that is a important MCQs. And I also want to here give one more example, like vitamin A. Vitamin A deficiency can also cause metaplasia, and the example of that is cratomalacia. Normally, the vitamin A is required for the you can say the squamous lining of the conjunctiva. It is required for the conjunctiva to differentiate its epithelium. But when the vitamin A is not present in our body, the conjunctival epithelium will not differentiate it well. So it will lead to the cratomalacia. So it is an also example of metaplasia. Then also another important example is myositis ossificans. I already explained this in the last day class. Let's take an example like a question. They will say a person come to you and this person is kicked by a horse in the you can say thigh, and after the horse kicking, he checked that the thigh size is increased, and he goes to doctor like did the x-ray, and he see there is a formation of bone in the muscle. Normally in the muscle you will get muscle tissue, normally in the bone you will get the bone tissue. But sometimes what happened, because of trauma, because of stress, there is a formation of bone in the muscle. It is called myositis ossificans. There is a formation of bone within the muscle after the trauma. It is called myositis ossificans, and it is an also example of connective tissue metaplasia. So please keep in mind, connective tissue or mesenchymal tissue can also undergo metaplasia. So that's all about the metaplasia. Here they can ask from you the different example, like vitamin A deficiency can cause the metaplasia, which an example like cratomalacia. Then GERD, gastroesophageal reflux disease, can cause metaplasia. Then they can also give you an example of like tobacco smoking or respiratory epithelium can also undergo metaplasia. So these are the different examples. And next we have the dysplasia. So first of all, we have to like get the clear definition. What is dysplasia? It is the disordered precancerous epithelial cellular growth. You have to keep in mind, and not considered a true adaptive response. It's mean if your cell is going to be disordered, if your cell is going to be converted into precancerous state, it is not a true adaptive response, and it is characterized by the a loss of uniformity of cell size and shape, which is called pleomorphism. And they can ask a question from you, how we can characterize the dysplasia. Dysplasia is characterized by the loss of uniformity of cell size and shape, which is called pleomorphism. And in the dysplasia also the tissue orientation will lose, and there are also some of the nuclear changes. If you are going to increase the nuclear like if you are going to pick the dysplasia, you have to keep in mind, when a cell is going under dysplasia, its nucleus to cytoplasm ratio will increase. And this is an important MCQs. When a cell is going under dysplasia, what is the ratio of nuclear to cytoplasmic ratio? So you have to keep in mind, nuclear to cytoplasmic ratio will increase, and it will become more clumped. You have to keep in mind. And the second thing, mild and moderate dysplasia do not involve the entire thickness of epithelium, may regress with elevation of initiating cause. So let's take an example. If a female is having cervical intraepithelial neoplasia, it is a mild to moderate. And if you are not going to like treat this condition, cervical intraepithelial neoplasia can convert into cervical cancer. So that's why there it's mentioned mild and moderate dysplasia do not involve the entire thickness of epithelium. Cervical intraepithelium neoplasia, it is a a kind of change in which complete thickness of the epithelium is not involved. And if you are going to treat this condition, this cervical intraepithelial neoplasia will not convert into cervical cancer. As you know, it is a most commonly caused by human papilloma virus. And if you treat this condition, if you alleviate the cause, then automatically it can regress. Then if you are not going to treat this condition, this severe dysplasia become irreversible and it will become into cancer, and cancer is always irreversible. So please always keep in mind. And they can ask from you in exam, what are the like cellular adaptation changes which can progress into dysplasia? So persistent metaplasia or pathological hyperplasia, these are the two conditions which can progress into dysplasia. So please always keep in mind. And I want to here add some important things in your cellular injury topic. In the cellular adaptation of the first aid, there are two definitions which they don't mention, but you guys can write here uh, the aplasia definition and hypoplasia. So let's take an quick review. What is the difference between aplasia and hypoplasia? So aplasia, basically when there is a failure of cell production during the embryonic period, it is called aplasia. And they can ask from you in the exam, can you give an example like unilateral renal agenesis? Unilateral renal agenesis means person has only one kidney, and it is an example of aplasia. What is hypoplasia? Hypoplasia means decrease in cell production during the embryonic period. If a failure of cell production, it is aplasia. If a decrease in cell production during embryonic period, it is hypoplasia. So that's all about, you can say, for the today class. Now let's have a quick review of this diagram. Here they mention. So let's take a quick review. First of all, these are the normal cell. So you guys can see these are the normal cell. Just this is the normal cell. And if you are going to put a stress on this normal cell can undergo different kind of changes. First of all, if the cell is going to increase its size, then it is called hyper. To increase in number of cell, it is called hyperplasia. You can see here are the four cell, but you can see if from the four they will become eight, it is an example of hyperplasia. But if these four cell only increases their size, it is called hypertrophy. And if they are going to decrease its size, it is called atrophy. So if you guys can understand this diagram, it will become very easy for you guys to solve the question in the exam. And if you are going to increase the stress and you are not going to remove the stress, that cell or that kind of stress can lead to the cellular injury, and that is irreversible. Irreversible mean you cannot now like correct it. If the cell is injured, it is in the irreversible state. And after that, you can also see they also mentioned the example of dysplasia, metaplasia, neoplasia. So basically, this is an diagrammatic, you can say, explanation. You guys, first of all, have clear concept about these terms. After that, you can read all these. So here, let's now take an example of normal cell with the metaplasia. Now you can see in the normal cell, they use only one color. But in the metaplasia, you can see the cell color is changed. It's mean the cell type is changed. And we know that when the cell type is changed, it is called metaplasia. And on the other side, you can see a normal cell and the change in cell structure. When the cell structure is changed, it is called dysplasia. So that how you can define the metaplasia and dysplasia. If you are going to change in cell type, it is metaplasia. If you are going to change in cell structure, it is called dysplasia. And if you will not remove the stress, these metaplasia and dysplasia can progress into neoplasia. It's mean they can progress into cancer, which is a change in cell type and cell structure. So that's all about for today class. You guys can review from your books, and let us know in the WhatsApp group if you guys have any question related to any topic, or you guys didn't understand anything from the first day.